Welcome to the Spartan Nurse Podcast. I'm your host, Dr. Mike Martell.
And I'm your co-host, Dr. Krista Reeves.
Today we're sitting down with Dr. Eric Wallis in the Henry Ford Health System down here in Detroit. Eric Wallis is a Senior Vice President and Chief Nurse Executive at Henry Ford Health. With over 20 years of experience in nursing and healthcare leadership, he is a transformational leader, passionate about building a healthy culture and improving healthcare delivery for patients and clinicians alike. Eric also serves as the Adjunct Dean of Nursing Practice at Michigan State University. Can you tell us more about yourself and what you do here at Henry Ford Health System?
Sure, thanks so much. And I first and foremost want to say thank you for allowing me to be with you a little bit. So my role at Henry Ford Health is, as you mentioned, the Chief Nurse Executive for the health system. So I oversee the practice of nursing and the delivery of patient care in all of our sites, whether they be our acute care hospitals or in our ambulatory settings across Southeast Michigan and even in our markets in Jackson and Grand Blanc.
That's a lot of employees.
It is.
Wow.
So yeah, roughly we're today somewhere near 15,000 bedside nurses.
Wow.
And just over 20,000 nursing team members. So it's a lot of folks, a lot of responsibility, but it's exciting. It gets me up every day to come in and say, how can we make the world better, not just for our patients, but for all those people that are trying to do that really important work.
Can you tell us a little bit about the collaboration efforts between Henry Ford Health System and Michigan State University?
Yeah, it's been very exciting. We've been coming together, I think, as we chatted maybe just a little bit before this, that just across the street from us is the first probably really big physical manifestation of that partnership. We have a $300 million research building that's going up, where we're going to have researchers from both Michigan State and Henry Ford coming together to look at how do we improve healthcare. We have a number of committees that have been pulled together to work on different aspects of the partnership, and probably one that we're most closely aligned with is we have an education committee that is really focused on nursing and where do we see nursing education and future of nursing be developed between Henry Ford and Michigan State. And so I'm excited to see a lot of that work starting to come together, whether it's in nursing research and how do we look at new areas of nursing and care delivery, whether we're looking at how do we expand the number of Michigan State nursing students who are here in the city of Detroit or at our Henry Ford sites. A lot of just exciting things, I think, going on in that space right now.
Talk to us a little bit about what benefits have students in the healthcare system experienced as a result of the partnership that we've created? Yeah,
I would start with one example that we've really looked at how do we make it a better experience for our students and improve their ability to learn while they're in our environments. And so over this past year, we've actually had some cohorts of students, one group I think at Henry Ford Hospital and one at Henry Ford West Bloomfield, that instead of doing a semester in a nursing unit and then going the next semester to a different environment, they're actually staying in place in that nursing unit throughout their learning, their clinicals, so that they have the opportunity to get to know that team, they get to know the patient population, the physicians, and I think it really helps them to start to be able to not just come in the first week. You got to figure out where the bathroom is and who's who and what do you do and where do you put your lunch, and to make it a more comfortable environment so they get to the place where they can actually learn more quickly and have those experiences. And I think the ultimate benefit is you're not just learning what you're supposed to do when you're in clinical, but maybe you start to learn why we do some of the things we do with those patient populations and why certain orders are given and why the protocols are where they are, and hopefully creating a better learning environment.
Mm-hmm. And I've had the opportunity and the privilege to come and visit some of these student groups and talk with them about how it's going and speak with management about how it's going, and overwhelmingly positive. I mean, the students absolutely love the rotation, the ability to work with the nurses and the management team, and it's stable. It's that stability because it's over time. So not having to come to a new institution, not having to relearn where the cafeteria is. Yep. It's sometimes those small things, the policies that are in place, they know them, the charting, the documentation, it's so great to have them come here to feel welcomed and part of the team. Mm-hmm. and to have that collaboration with the staff and the management to really feel like they too are serving to benefit the patients rather than just coming here to be a guest and kind of out of place and not sure what to do. They really feel embedded on those units, and it's just been overwhelmingly positive.
Absolutely. And hopefully, they get to start to learn the culture.
Yes.
Right. So I think one of the hardest things about being a student nurse, and then as you start to think about transitioning into your first job, is you're trying to make that decision on where do you want to work and what kind of things do you want to do, often based on an interview, and maybe you get a chance to shadow or walk around. But, these students are getting an opportunity for, multiple semesters to really interview their potential employer too.
Mm-hmm.
They get to learn the good, the bad, the ugly, and who are the nurses they may want to work with, and maybe who are the ones that they wouldn't. So hopefully they see that as a benefit to them as well as they're thinking about their future career.
Mm-hmm.
That transition to practice can be so difficult. So anything to smooth that transition. Can you expand a little bit on the partnership and supporting research and innovation in nursing practice and where we're headed with that?
Yeah, no, it's a great question. One of the really cool things about the partnership is, both organizations have committed some resources to the partnership to move the goals forward. And so specifically in nursing research, we actually have a joint position with a nurse scientist. Her name's Dr. Neutrina Tate, and she is incredibly experienced. She's worked both in the space of research, but she's also worked in academia. She's also still working at the bedside from time to time. And so her ability to pull together those different elements and really, when we start talking about nursing research and evidence-based practice, make it real.
Mm-hmm.
And so how do we bridge the great research that's going on at Michigan State and actually move it to the bedside with our nurses who are taking care of patients? And so I think that's, one example of, how do we work together to, really not just have these kind of silos of great things going on, but how do we actually put them into practice to benefit our patients, the communities, our nurses? Her work to really get bedside nurses engaged and involved in actually doing nursing research and answering those, tough practice questions, and doing it with Michigan State nurse scientists and researchers in partnership, I think is really exciting.
Yeah, that sounds really, mutually beneficial, but then ultimately that the patient is who benefits because of the increased quality and safety and all kinds of things that are happening because of that. Getting those bedside nurses involved is so huge because they're working with those patients every day. So I think that's amazing.
And the reality is that who better to tell us what things don't make sense or aren't working than the nurses who are dealing with it each and every day, right? We know that they have great questions. They have great ideas. They are looking for things in the evidence to say, how do we do this? And when there's nothing there, right, giving them the opportunity to actually ask those scholarly questions and having a resource that can help move that forward, as opposed to, okay, now but I got 5 other patients to take care of, and so I gotta let that thought go and maybe I never get back to it. So I think those are some of the opportunities that we can capture in the moment and give them a resource to help answer some of those challenges.
Mm-hmm. And we have the support in place. Everything that Henry Ford has to offer and the supportive measures that they have, and then Michigan State University with our research center at the college. I mean, we have just great tools that we can use to make a great impact. What advice would you give students as they prepare to transfer into the workforce?
Yeah, I can tell you to this day, when I came out of nursing school, I was very set that I was going to be a CRNA.
I love that you say this. This is
very
a lot
common,
of our
right?
students.
And after a year of working in critical care, I said, no, that's not what I want to do.
Right.
Then I thought, well, maybe I want to be a perfusionist.
Okay.
And spent a little time with some folks that did that work and said, that's really not what I want to do. And what I found out about me was that I wanted to make a difference in not just for the patients, the 2 patients I was taking care of in an ICU, but I wanted to make a difference for my colleagues. I wanted to make a difference for how all the patients that we care for got care. And so leadership became the aha of how I need to do that.
Mm-hmm.
And so I think, if you talk to a lot of senior nurses, you'll find that very few of us are in the place that we started or thought that we wanted to go. And that as you get exposed to these different types of nursing, you'll find the place that's really your passion. We were joking that, you can walk into a lot of places and ask folks who wants to work in, women's or pediatrics, and a lot of hands will go up, right? And and I think that what you see is that as people come into the workforce, they find that maybe that's not quite the place that they want to be. That there's other things that they're passionate about, other patient populations that tug at their heartstrings, and so you kind of find your spot. And so I would give everybody the advice that, if you absolutely know heart of hearts what you want to do, then, talk with those managers, talk with those leaders when you're in your clinicals, right? Don't be afraid to go knock on their door and say, hey, I'm really interested in working here. Here's what my passion is. Here's what my why is. And those nurse leaders can help you make that a reality. But if you're not 100% sure, getting into a place where you've got a good relationship with the leader, you've got a good feeling and relationship with some of the nurses that you've interacted with in your clinical rotations, that can be a great place to start so that you get your feet under you and learn why you do the things that you do, how this nursing thing works. And then, take the opportunity to look around and get exposed to different aspects of healthcare delivery and figure out which one is really your passion. I am extremely fortunate. I'm married to a nurse as well. And so, we worked together in a critical care unit. I went into leadership. She thought that she wanted to go work in labor and delivery. Believe it or not, she lasted there 9 months because she figured out it was not for her. But she then went to work in the cardiac cath lab, and that's where she has spent the remainder of her career, is because that's where her passion was. She loved working in that environment.
What a change!
Yeah, so it's okay. You may try something and go, oh gosh, this is not what I thought it was going to be, and that's part of a healthy career pathway, is when you can do that and recognize it, and then have a professional conversation with the person that is leading that area and say, hey, here's what's going on. I'm not trying to hide anything. I'm trying to be honest that this isn't for me.
That's awesome.
And I think too that doing that really allows the units and the staff that are on those units to really actually be happy and thrive and have high job satisfaction.
Absolutely.
Because the people who don't want to be there move on and go to a place where they do want to be.
Absolutely.
And so it probably makes the unit a lot more tighter as far as the culture goes, and improves nursing satisfaction as well.
Yeah, and I think you start to learn what a good unit looks like, what a good culture looks like, right? One where the nurses have a voice, where there's a strong shared governance model, where people can be engaged. I know there's thoughts out there right now that, oh gosh, this new generation, we've said this about every generation of nurses, right? This new generation doesn't want to be engaged, they just want to come in and go home. And I completely disagree with that. They may want to be engaged differently, right? How do we make it flexible? How do we make it easy? Can they do it virtually? Can they, do it in a time that doesn't take away from their personal lives? And I think finding places that, our bedside nurses have input into the work that they do is so very important. That's why for us, having all of our hospitals on the journey to become magnet hospitals puts a stake in the ground to say that's the kind of environment that we want. We want an environment where nurses are engaged and they help make decisions about how we do the things that we do.
Mm-hmm. So talk to us, what are the biggest challenges facing the nursing profession today?
It's a great question, and I don't know that there's one.
True.
I think the biggest thing, and probably what was exacerbated by the pandemic, was many nurses who had been in the profession that, were just kind of toward the end of their career and hanging on, were able to retire and chose to do so. Mm-hmm. And so, you look at the state of Michigan, and depending on what statistic you want to look at, we're probably somewhere between 80 and 100,000 nurses short. Just trying to think about how do we build the nursing workforce is so important. I am personally, and one of the things that Henry Ford has not engaged in is we're not going out to nursing students who are in their, hey, you're just starting in nursing school. Would you like to sign a contract?
Come here.
I don't think that that's healthy. I don't think that students who have never even set foot in a clinical can tell you that they want to come work for your organization and are committing to 2 years after they graduate. What we have been much more focused on, and one of the really unique things I think we've done with Michigan State and a couple of our other academic partners is looking at how do we increase the number of people that want to be clinical faculty, so that we can actually grow our nursing programs. I think, when you look across this country and there are 800,000 people, potential nursing students being turned away, that want to get into a program, but there's no spot for them. That's the problem we've got to fix. And so it's something that, Dean Small and I have had a lot of conversation about is, how do we grow the capacity at Michigan State and really all of our academic partners to get those students who really want to be nurses able to be in a program so that we can grow the nursing workforce. I think nursing is now, and it just came out recently, the 23rd year in a row, the most trusted profession. So that's exciting that we've maintained that place that the public trusts us more than anybody else, and so we've got to take advantage of that and find ways to when people want to be nurses, how do we get them into a program and actually let them start on their career path.
I think that is great, and it's important to be forward thinking with that, because you think about there's a nursing shortage. Well, then how many of those nurses go back to school for a master's degree or a DNP or a PhD to be able to teach? So your pool gets smaller and smaller.
Absolutely.
So being able to find and pull those clinical faculty, because a lot of times that's where the shortage lies, is we can't admit more students if we don't have the faculty to teach. So I love that idea. So kind of on that note, let's talk for a minute about transformational leadership and how that plays a role in the workforce retention and in burnout.
I think so. I almost struggle to have the word transformational in anything that talks about leadership, because it's such a buzzword sometimes.
It is.
Ask somebody to define it. What does that mean? Nobody knows. But it looks great on a resume. I think the essence of the idea of being a transformational leader is you have to be open and willing to change, right? You have to be constantly asking the question, how can we do this better? And the reality is we don't all come to this with all the answers, and that, we learn things in our jobs that make us successful. And then usually what we do is we promote that person to the next level, and those same things don't work anymore, right? So you have to really be focused on how do you constantly have a mind of learning, fine-tuning your skills, being vulnerable, to say, hey, that didn't work. I really screwed it up.
Right.
And I think that being willing to push the envelope all the time to say, yes, I know that's how we've always done it, and maybe it has brought us some success, but there probably might be a better way to do it. And constantly being willing to tweak at the edges and say, how do we make this better? At the end of the day, I think for me, and when you talk about transformation and leadership, it's really that idea that says things are never going to be the same every single day, right? And if we come to work every day going, how do we get 1% better or a little bit better, or how do we stay focused on improving the way that we deliver care or the care that is delivered, then that's how you constantly are in that mode of transformation. I'm old enough to remember, proud member of Gen X, that, we would work with nurses on the floor and they would say, I hate change. I hate when we change things. It's not what I signed up for. And I think now the cool thing about the generations that are coming in or have come in since is they don't have that mentality. They expect things to change. And in fact, if they're not changing, sometimes they get bored. But the healthcare is constant change. I think what makes it so hard for both physicians and nurses is you go through all of your academic learning being told this is best practice, this is the only way you can do it, this is the right way. And the minute that you step into practice, someone's going to tell you, no, you don't do it that way. Right. And you have to then decipher, is that we don't do it that way because this is how you've always done it, or we don't do it that way because the evidence has evolved and there's a new way to do it. But you can be certain, right, that as you come into practice, you're going to spend the next 40 years of your career constantly learning a new way. because stuff's going to change, things are going to evolve, the tools are going to evolve. I mean, just when you look at healthcare IT, when we start talking about artificial intelligence and virtual care models, and there's so much changing right now that I'm excited about, because for the first time in 30 years that I've been in nursing, we're actually using technology to take workload away from our nurses, as opposed to adding more on.
Right.
And I think that, I'm excited to see that, and I'm excited to see our newer nurses often leading the way, because they're not stuck in the rut of how they've always done it.
Right. And it sounds like it's really cultivating that culture of change and being, forward thinking and being willing to put out ideas and then go for it. So I love that.
And I think that culture does make such a huge difference. I always tell our nursing students, when they're going out there into the workforce, be careful of, sometimes the most negative nurses and the most nurses that are resistant to change will be the most vocal sometimes. And so sometimes you really have to be careful of that and really find those positive influences on your career and your practice, and focus on those ways that you can make a difference in your patients' lives and those things that you've done at the end of the day that really did make an impact, because sometimes things can get a little bit negative in certain environments and things, and it's really important to keep that positive outlook.
Yeah, it's I probably get myself in trouble for saying this, but often if you find those people that are negative about everything, they're usually the ones that are causing the negative about everything, right? And so truly, again, and it's part of that transitioning into your first job is finding the places that don't tolerate that, right? That don't put up with folks who are always trying to bring the group down, because those are really tough places to work when you have those individuals. If you can find a positive environment where bedside nurses are engaged in making decisions and driving stuff forward, those are great environments to work in. The best place I ever worked as a bedside nurse, our nurse manager never had to tell you made a mistake, because your peers held you accountable, right? And so you didn't want to let your peers down. And it was always there was always positive reinforcement, but if you screwed up, they'd tell you, right? And if you did a great job, they'd tell you. Those are incredible environments to work in. And that's what I think you're really looking for, is a place that's open and honest and wants to have a great team that will work together.
Yeah. So too, with the partnership between Michigan State and Henry Ford, launching these different models, the clinical model that we have in place, it's been great to see the students be part of that culture and to be embedded on those units. And then I think we're seeing kind of the fruit of our labor, because the students then go on to work for Henry Ford. Right. And I think that speaks volumes to Henry Ford as well, because they're seeing, I do want to be here. I've been here for my whole nursing career, for all of my clinicals, and this is the environment that I want to be at. This is the culture that I'm looking for. And so I think that's what makes the partnership so beautiful, is we educate on our side, you guys train at the bedside with our students or even in the community, and then when they're done, it continues on. Like, it's such a great collaboration effort. We'd like to thank you, Dr. Wallis, for coming on the show and sharing all of your insights.
Yes, thank you very much.
So we invite all our listeners to subscribe to the Spartan Nurse Podcast.
To find your breaking news and latest updates within the College of Nursing, please refer to our website at nursing.msu.edu. You can also find us on all social media platforms at MICHST Nursing.
Thanks for watching.
Who will?
We will.